And I think I'm going to call on Rebecca Finks with the Low Income Housing Institute. If you would be gracious enough to start us off this morning, Rebecca.
Hey everyone, I'm Becca with I work with the Tiny House program. I am just here today to learn more about what is going on in the realm of homelessness. I mean, I work directly with it, but in a very specific ecosystem of this tiny house villages. So I'm excited to see more about what's going on.
Rebecca, we're having a little difficulty hearing you. Are you able to make us out okay?
The progress that's been made from defunding and moving it.
Jason, I think you might need to invite.
Sorry?
I was just going to say, I think you might need to invite someone else other than Rebecca to read the mission and vision statements today because it's really hard to hear her. I'm so sorry, Rebecca.
Sorry about that.
Sorry about that. Let's see here. How about Nefertari? We heard you coming in loud and clear earlier. Would you be willing to read the statements for us today? All right, apologies for the technical difficulties on our end here. Christopher, are you able to see the statements there?
Yeah, this is actually my first time in this meeting, and I'm so I feel so privileged to be here and to be able to meet and listen from all of you. But I don't see the missions. I've never read the mission statement. I'm not gonna lie, I'm here to learn. Do you know where I could find that? I'd be more than happy to read it.
It should be on the screen there. We're sharing the intro slide with the information. I realize that not everyone may be able to see that based on your technical setup.
It says that that your account is sharing the screen, but doesn't show me the content that you're sharing actually.
Yeah.
And it looks like Carlos just echoed that on the group chat.
I'm able to see it.
Oh, cool.
You are?
Is it the general membership meeting?
Yes, that's right. It's the last two sentences at the bottom, if you're able to read that out.
I can see it.
Would you be willing to read that for us this morning?
I guess, sure. The mission and the vision, is that what you'd like me to read?
Yes, please.
Okay, the mission is we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. The vision, a region that acts on a shared sense of responsibility to ensure that everyone has a home.
Thank you so much.
Mm-hmm.
So we'd like to start the meeting this morning with a handful of coalition updates on some things happening in the community that we want to make you aware of and hopefully connect you to some follow-up resources. I see Allison has her hand raised.
Yeah, thanks, Jason. I am not sure, Sasha and Jason, what is going on, but I'm going to suggest that you stop screen sharing for this portion of the meeting. Let Sasha see what she can figure out because we'll definitely need the screen sharing to work when our friends from the Healthcare for the Homeless Network join us a little later on. And now we can see more people. So thanks.
Excellent. Thank you so much, Allison. Okay. So we'd like to begin this morning by checking in on the 2020 census. The 2020 census is currently underway and is unfortunately under attack. So first, sort of a brief overview. The census is a once every 10-year survey or count of all persons residing within the United States of America. It's mandated by the Constitution that this happen once every 10 years. And we are in the middle of the process of counting folks for this round. The census is important because it has significant implications for money that comes into our communities, as well as political representation. Here in Washington State, the results of the census determine where roughly $17 billion a year get allocated. That's everything from TANF grants to Medicaid block grants to states to Section 8 vouchers and a whole host of other community programs that we rely on. In addition to that, the results of the census determine where political boundaries are drawn. Everything from what city council district you reside in, all the way on up to who your congressional representative is determined by the results of the census. And census data has really profound planning implications when hospitals and healthcare providers consider where they expand, when transit agencies consider where to put their infrastructure, when businesses look to expand. They look at census information to understand what their community looks like. So there's really profound implications for this once every 10-year count. And we know that certain populations of people, such as children under the age of 5, immigrant and refugee communities, and people experiencing homelessness are historically undercounted in the census. And even a relatively small undercount can have really huge ramifications for our community. And as you may have been tracking in the news, there is a concerted attempt by the federal government to stymie the census and prevent it from giving a full accurate count of people in this country. On July 21st, the federal government issued a memorandum stating that they would like to not include non-citizens in the apportionment base of the census. And what this essentially means is that when they report the census figures to Congress for congressional redistricting, they are going to attempt to withhold the count of undocumented or non-citizens in that final count, which has pretty big ramifications for political representation in immigrant and refugee communities. There is currently a lawsuit that's been filed to challenge this. King County is one party amongst many other local governments and nonprofit organizations that are challenging this decision. Similar to the previous effort to try and add a citizenship question to the census, this is sort of meant to sort of strike fear and confusion in the process. And in addition to that, the census data collections operations have been suddenly cut short. On August 3rd, the Census Bureau announced that they were shortening the data collection deadline from October 31st to September 30th. So instead of having till the end of October to give folks to fill out the census, we now only have until the end of September. So this is why we wanted this to be the first topic that we touched on today. We have 6 weeks from today to ensure that the census operations are as successful as they can possibly be. And you all are in a unique position as service providers, people working with members of the community, to help the folks you work with and serve fill out the census. So really quickly, there's 2 main ways in which a person can fill out the census: online as well as over the phone. Online, you can go to 2020census.gov and fill out their page. Most households have had a census ID number mailed to them that they encourage you to use to track, although you don't need your unique census ID number to fill out the census. For people who don't have a traditional street address, who may be experiencing homelessness, there is a box that you can check on the online portal that says, "I do not have a street address." And that will take you to a screen that will allow you to fill out sort of a narrative description of where the person spends their time. It's sort of a text box that has as many as 400 characters that you can put in. So you can describe a street intersection or a temporary housing situation, whatever is most accurate for where that person was staying as of April 1st, which is still the deadline that they're using for this count. There's also a toll-free phone number that can be used, and we encourage you to use this option if you're working with people who might need language translation services. They have roughly 20 options available. Those are not necessarily cheap calls, and so we encourage you to be thinking about how to provide that for your clients if they might be needing it. Now, specific to folks living unsheltered, there is a process through which the census counts these people at the locations in which they access services, and this is called service-based enumeration. Service-based enumeration is a project of the census to survey people at emergency shelter programs, meal programs, mobile medical vans, places where they may congregate in which to access services. This survey process is going to be happening in September 22nd through the 24th. September 22nd, the census is going to be conducting a survey of people staying in emergency overnight shelter programs, time-limited transitional housing programs, and other forms of sort of temporary residence. On September 23rd, the census is going to be surveying people at feeding programs, soup kitchens, and mobile medical vans. And then on the evening of the 23rd and going into the early morning of the 24th, the census is going to be conducting a point-in-time count style survey of people who are living unsheltered outside. Now, I've sort of given you the bad news that there are attacks to the census and there's efforts to undermine it. The good news is that we're not in this fight alone. We are lucky enough to be in a community with a lot of really engaged organizations that understand the importance of this and have resources that they want to help connect you to make this process more successful. We're joined on the call this morning by Michaela Vero with United Way King County, who has been really involved in some of these efforts and has some resources to share to connect you to this effort and to hopefully make the service-based enumeration process a little more streamlined. Michaela, thanks for joining us here this morning.
Excuse me, of course. Thank you so much for having me. Can you hear me okay? I think I'm having some internet issues. Okay, if that changes, let me know and I'll turn off my video. But yeah, thank you so much for having me. So thankful to be here with you all this morning and talk about the census. I have been living and breathing census for a long time now, and this count of people experiencing homelessness is something that's, I think, making a lot of us lose sleep at this point, because it's, I feel like we're nearly guaranteed to have an undercount at this point. So we just all need to work as hard as we can to make sure that the count is as close as possible, and also that we're documenting all the ways that we have tried to make this count successful and the ways that maybe the Census Bureau or Congress has made our jobs even more difficult. So like Jason said, this count was always going to be hard, even before COVID hit, because it's the first time this form is online. And then COVID happened and the services that are being provided changed. And then politics got involved and there's some new political appointees and all the stuff Jason just mentioned. But specifically now, we're really worried that the count has been cut short by a month. So we were supposed to have until the end of October. We now only have until the end of September, although there is great advocacy happening both on the local level and the federal level to try to get that deadline pushed back to October. And that's coming from Democrats and somewhat of Republicans, and from career Census Bureau staff who really do believe in the integrity of this data and are doing their best to make sure that this count happens well. So what we are trying to do is just make it as easy as possible for the Census Bureau to count our community. They've always had somewhat of a list of where they need to go to do this service-based enumeration, but I know a lot of the sites and the places where people were getting services have changed because of COVID, whether that's opening of additional sites, changing of hours, like just different services that may be provided. So what Jason and I would really love to do is just start to collect a list from all of you and anyone else in your networks. Specifically, if you have not yet heard from the Census Bureau, that count is happening, like Jason said, September 22nd to 24th. Some folks I know were contacted as early as July from the Census Bureau through the process they call advanced contact, where they contact an organization and try to schedule and figure out the exact methodology of how to count that location. And we know that that has not happened for a lot of people yet. So Jason and I have a survey that will pop into the chat and would love for you to fill it out. It just basically asks like, hey, have you been contacted yet? If not, give us the details, and then I will get that over to our best contact at the Census Bureau, who's working really diligently with this, with us on this to make sure that this happens as well as possible. So we'll share that survey with you, and we would love for you to share it as widely as possible. But like Jason said too, you know, that's one way that people can be counted, but really in any interaction you're having or anytime it's possible, if you can have people fill out the form individually, that would be just immensely helpful. It's okay if somebody is counted both individually, like with a case manager or at a service location, and then also counted through the formal service-based enumeration process, because the Bureau will deduplicate that, and that's not on us to worry about. We just need to make sure everyone is counted. And then I'll also plug, we do have a flyer that we created. I'm part of the We Count Washington campaign, and we do have a flyer that it's a 3-page document that lists out how to count people experiencing homelessness and like walks you through the form of how to answer the questions, especially if someone doesn't have an address, and like what buttons to click to make that still possible. So please feel free to use that, share it. I hope it's useful. If there are other things that we could create that would be useful, I would love to make that happen. I'm super focused on this count for the next month because we need to make sure that this really, really happens and happens as completely as possible. But there is like a little bit of celebration, which is important these days, and that is that Washington is number 3rd in the country for our response rate. In 2010, we were 21st. So we are doing really, really well as a state, and I think that's something that is worth celebrating. Let's just make sure that our count of people experiencing homelessness also shows like that same level of success. Another thing I want to,
Michaela,
yeah.
My apologies. I do want to make sure that we move along to the rest of the agenda items. We really appreciate you putting that survey together. Please circulate this amongst your networks. We want to be a conduit to help your program communicate with the census to make sure that the service-based enumeration process goes as smoothly as possible. And please feel free to send Michaela and myself questions related to the census that we can forward on to the right people. Michaela, thank you so much.
Of course.
Allison, do we have a time for a handful of quick updates, or should we?
Well, let me just say, I think maybe the first thing is it sounded like it's so hard not being in the room together, but I got the impression that Michaela had another important element, and I know you're trying to accommodate me, Jason, and I'm trying to accommodate our guest. But Michaela, if you want to just quickly finish the thought that you were going to say related to the census, let's wrap the census piece up, and then we'll do a little adjusting.
Sure, thanks. Sorry, I'm a little long-winded. Just real quick, 10 seconds. Our We Count Washington campaign and a bunch of people from around the state are planning a day of action on Wednesday, September 16th for the census to get one last big positive push out there to get everyone to be counted. So I'll send those details to Jason when we have them. Jason is looped into those meetings. So just put a little bug in your ears, September 16th, statewide day of action for the census.
Thank you so much, Michaela. We really, really appreciate the opportunity to partner with you and with other advocates. I will say the very last in-person meeting that I attended before we all stopped going to in-person meetings was a meeting about the 2020 census with Michaela and others. And at that point, we were already incredibly worried about people experiencing homelessness not being counted. And then COVID-19 got really, really serious. So what I want to underscore is the point that both Jason and Michaela touched on, which is it is fine if people complete the census or are counted twice. The whole beauty of the census is the power of deduplication. You all, as advocates and service providers, have an incredible privilege and opportunity to help people be counted. And frankly, just as Kamala Harris said last night, why is it that they don't want us to register and vote? People should be thinking the same thing about the census. I live in a pretty well-to-do, largely white North End part of the city. I did not complete the census online because I wanted them to have to send me the hard copy because I wanted to see the physical paper because we struggled so hard to get them to give us paper copies for people who are homeless to fill out. I have been visited 3 times by people knocking on my front door trying to get me to fill out the census. And I guarantee you that is not happening for the folks that we are concerned about. So thank you guys very, very much. We are going to move on, but I want to say we're also working with the city and the county to try to make sure that we're not duplicating effort, but that survey that Jason and Michaela set up, what we mostly need to hear is, have you not been contacted by the census if you run a program? Okay. So we're going to shift gears a little bit. Jason has other very important updates, but I want to respect the fact that Yvonne Nelson with the REACH program that's part of Evergreen Treatment Services has most graciously agreed on like 0 notice to join us. And I know she is a very, very busy woman and has probably other things she needs to do, but I want to welcome Yvonne, thank her for joining us. And this is an opportunity for me to just very briefly talk with you all about the budget process at the City of Seattle and our collective work to defund the NAV team, which I am really pleased to say looks like in its current iteration has in fact been ended. So I think that that is a significant accomplishment in terms of protecting people experiencing homelessness who are living in public from harm paid for by your and my tax dollars, as opposed to the kind of support and productive engagement that many of the coalition's member organizations, including REACH, are very experienced at doing. So just to recap, I think everyone here knows, whether you live and work in the City of Seattle or in another part of King County, that the City of Seattle, the City Council and the Mayor had to go through a process of rebalancing the 2020 budget. We're more than halfway through the year, but the combination of COVID-19, huge spending that was unanticipated, a $300 million revenue shortfall that actually is now probably bigger than that, and the community uprising and demands for realignment of the public dollar investments in things that actually produce better, true community safety have meant that the last 6 weeks or so have been a pretty extraordinary effort to redo the 2020 budget. We are very clear as a coalition. We do a lot of budget advocacy. Many of you who've been part of the coalition have participated in multiple campaigns to insist on priorities that that really reflect our values. And at the same time, we wanted to respect and recognize the fact that other voices really are leading right now. So we wanted to be very intentional about how the coalition showed up in the 2020 budget conversation, both as an organization and with and on behalf of our members. I had the opportunity to connect with folks at Decriminalize Seattle who were doing a lot of the work on the budget rebalancing, as well as, of course, with staff at the City Council. And this is the result. We worked very closely with City Council member Tammy Morales, as well as with other City Council members who have led on rational public policy to say the NAV team isn't working. It is a failed experiment. It costs $8.4 million a year. And the stranglehold on the ability to refer to hundreds of shelter beds in our community is just one example of one of the policy changes that can and must be made. What we have always said is that there are opportunities for productive partnership between service providers and law enforcement, but leading with law enforcement and leading with the premise that people need to be moved, as opposed to with the premise of understanding who's there, what they need, and how to offer something better, is not effective, and it's very wasteful. So without my going on and on about it, I really want to invite Yvonne to share with us her perspective and knowledge and experience. Yvonne has a lot of background in working with people experiencing homelessness outside. She also has a lot of background in working with the NAV team. And she and I were on a panel last night, yesterday afternoon, I guess it felt like last night, with Seattle City Council member Andrew Lewis and a number of other service providers talking about other kinds of effective, good outreach. And I asked Yvonne on the spur of the moment to join us. So I'm turning it over to you, Yvonne.
Hi, thank you for inviting me. Hi, Jason. You're a wealth of knowledge, so thank you very much. And Allison, yeah, I don't know when you sleep. So thank you. And I am not really sure where to begin, so I'm just going to begin, and I'm going to talk about outreach pre-NAV. What would happen is that we would be allowed to build relationships with people and come back to where they are. The process of the NAV team was kind of confusing. It appears to me that police officers are enforcers and not social workers. And so what we got a chance to do is kind of try to work through some of that. And we butted heads the entire time. The NAV team is about property, not people. And so that played out. Fourth in Yesler was a prime example of how much money was wasted. They would clean it every day. They would have parks there. They would have garbage. They would have other entities there. And it just, and the people would come right back. And it just, I couldn't wrap my mind around what the point of that was. And so we would ask to speak with the mayor or leadership, and our not demands, but our request went unanswered. And so it just did not work. They would throw away people's belongings. They would say that they would store people's belongings, but people could not get their belongings back. It was a long process. They had to have a phone, which we know most people do not keep a phone living outside. It just did not work. And just showing up to encampments with the police, just a history of people of color engaging with police officers freely and giving up information did not work. And so what I have seen as the NAV team continued to move people, as people went further and further away, which means they did not get services. That meant they couldn't get out of there adequately to access hygiene, laundry services, medical services, and all of those the like. What we have been doing currently is going in to communities, like my community is the central area and all the Rainier Valley. And what I get to do now is build relationships with community and people that are living outside. That includes RVs, that includes Starbucks, Walgreens, community centers, food banks, all of that. And the community know their people. They know their people. And so I am not having to go find a person this day and then, you know, a week later, I can't find them. And we had things going on like ID, medical appointments, things like that. And so I think that it would be, the NAV team as it is does not work, and it did not work. And it was a failed experiment, as you say, Allison. And so I just like the idea of building relationships with the community and the people that live there. So if that, I didn't even know it was that much money being spent, but it looked like a lot of money when we were in the process of that. Just the garbage trucks. Now, we need garbage, but we didn't need garbage and police officers. Like they say that they would ask, but when a police officer walks up to me and asks me to move, I'm gonna move because there is the thought of me going to jail or being harassed on a regular basis. So that's my piece about pre-NAV, during NAV, and now. Thank you, Allison, for inviting me.
Yvonne, thank you so very much. We are really in a position now, I think, to invite folks like Yvonne, her colleagues, the people who do outreach at the Urban League, Chief Seattle Club, Youth Care, DESC, and a number of other partner organizations to educate and inform about the range of ways that they engage and build relationships, and for us to remind decision makers that when this work is done well, it is effective. It is also a public health intervention. And also, of course, we are under no illusions. Outreach alone, without quality other places for people to be, is never going to be adequate. So we're, I think, at the point, I want to say this particular piece of the decision in the budget legislation came down to a 5-4 vote. Councilmember Morales, Councilmember Herbold, Councilmember Mosqueda, and Councilmember Sawant co-sponsored the amendment, and Council President Gonzalez cast the 5th vote. The other council members voted no, including Councilmember Lewis, who hosted us at this conversation yesterday afternoon. So it was an opportunity for us to educate him, as well as the broader community, to talk about the fact that we absolutely support garbage pickup happening. We just don't support people being treated like garbage. And we're continuing to push, of course, on all of the other elements of this that are essential, including much better access to hygiene and sanitation, more shelter capacity that works for people, and of course, more housing. And I want to acknowledge that just last week, we also saw an incredible announcement come out from the city of Seattle, from the Office of Housing and the mayor, again, in part thanks to the advocacy work that we all have been engaged in, that there are going to be 550 to 600 more permanent supportive housing units rapidly put into the pipeline and developed over the next 12 to 24 months. And that is an extraordinary number and an extraordinary pace. We are very excited about that. And at the same time, we know that essentially we have had no additional shelter created during COVID-19. So we have a lot coming up with the 2021 budget. And that's why I want to say we are convening, the coalition is convening our members, not only folks in Seattle, but countywide, who provide shelter and outreach services to help do some of the big picture thinking about what level of investment and type of service we need to scale up. What Yvonne described is this assertive, neighborhood-based, collaborative outreach that works not only with people experiencing homelessness, with residents, with business owners, I should say with housed residents as well as unhoused residents, with business owners, with city employees, and even, yes, with law enforcement, but that doesn't lead with law enforcement. And so we'll be engaging in that work in anticipation of this being part of the body of knowledge that we need to bring to the community. You are probably aware of the fact that usually city budgets are a 2-year cycle, And this year, because of the enormous uncertainty, both with the revenue shortfalls and with COVID-19 being truly an exercise for all of us in not knowing and yet needing to plan, the City Council is only going to do a 2021 budget, not a 21-22 budget. That is going to be a very different kind of budget process, and it is basically starting in a few weeks. I mean, in some respects, it's already started. So we're going to continue to try to feel our way, honestly, to be good partners, to lift up the voices, particularly of Black, Indigenous, and other people of color who are doing the work across our member organizations, so that their knowledge, insight, and personal and professional expertise helps to inform what gets funded in the budget. But I want to be really honest with you all. Realigning the budget isn't easy, and the revenue shortfall is real. So our work to secure additional progressive revenue is even more important. And since the last time that we met, and now, the City Council has passed, the mayor has vetoed, and the City Council has reaffirmed the Jumpstart Seattle legislation, which is a corporate payroll tax that is going to bring in about $214 million a year to support important COVID-19 relief work in our city, as well as invest in housing and good quality services. There is a massive negotiation underway right now about just how much of those resources it's going to be possible to get out onto the street in the remainder of 2020 and in 2021. And if you've been following along at all, you will know there's basically a huge struggle between the mayor and the City Council about how much money should and could be spent this year and what it should be spent on. So stay tuned. And we expect that beginning, I would say in the third week in September, we will have a lot of budget advocacy for us to do. Okay, I think I'm going to, if you have questions for me about that, please put them in the chat box, but I'm going to turn things back to Jason to navigate us through the rest of our agenda. Yvonne, thanks a lot. See you soon.
Thank you, Yvonne, and thank you, Alice. And just to echo what she said, we really do want you all to be engaged with us in this process. So do be on the lookout for updates from us as the budget process develops. So we want to touch on a couple of quick other community updates as well. We wanted to briefly mention the proposed rule change by the Department of Housing and Urban Development as it relates to the equal access rule. In 2016, HUD sort of reaffirmed its open access policy towards trans and gender nonconforming clients in emergency shelter programs by stating that a single-sex emergency shelter program needs to accept someone based on how they self-identify their personal gender, not based on someone else's subjective opinion. The Trump administration is hoping to reverse that 2016 guidance and basically put that discretion back in the hands of local service providers to make a subjective determination as to whether someone appears male or appears female enough to be granted access into an emergency shelter program. We know that this will have profound ramifications for the LGBT community. Roughly 20% of trans people experience homelessness in their lifetime. That number goes up significantly for BIPOC trans individuals. The information on gender non-binary people is a bit more limited, but we do know that that population also experiences very disproportionately high rates of homelessness as well. And roughly 50% of trans and gender nonconforming individuals who have access emergency shelter programs in their life have reported some form of difficulty, be it harassment, judgment, unacceptance into their program, etc. So we're really committed to making sure that we give you all an opportunity to voice your opposition to this. Here in Washington, we do have some protections. Emergency shelter programs are considered to be public accommodations and therefore are protected under local civil rights ordinances, although this hasn't necessarily been tested in court. And we know that when federal changes come, it sort of increases the temperature on these issues. So in the link, or in the chat rather, we're going to drop a link to the Housing Saves Lives Coalition. This is a national advocacy coalition group that has formed in opposition to this rule change, that has created some templates to make it easy for you to submit public comment to HUD in opposition of this change. Something that I really want to stress when you do this is that we ask that you make your comments unique and personalized. The way in which the federal government looks at these comments is they consider the same comments with the same language should be one comment. So what they're looking for is unique comments. They ask that you please make at least a third of what you send something that you've written yourself. That way their algorithm that they're using is able to distinguish it as a unique comment. The deadline for the submission of public comment is Tuesday, September the 22nd. So please, if you can, take a moment to submit comment, share this within your networks, and sort of let it be known that our community stands by its trans and gender nonconforming folks and believes in housing access for everyone. And then we have a couple of resources that we want to share with you all. And these will be links that you'll see in the follow-up email that will be sent after here. First, we wanted to give you an update on the Pandemic EBT program. Pandemic EBT, for those who don't know, is a food relief program that was made available through the Federal CARES Act, the COVID Relief Act. It is a one-time food voucher that is available to families who have children that are eligible for free or reduced price lunch, or meals rather, at the schools they attend. This is essentially providing the cash value on a food voucher of meals that were lost due to school closures related to COVID. And it's a fairly significant benefit for children that have been eligible for reduced price meals since COVID started. Those families can receive as much as $399 per child. Now, there's two groups of people here that are getting this benefit. There's the families that are already enrolled in the federal SNAP program. All of those households have automatically received their benefits added to their regular EBT card. But there's about half of the eligible families who qualify for free and reduced price lunch, but are for various reasons not enrolled in SNAP. Those people need to apply by either calling DSHS or going online. And the enrollment numbers for that particular segment of the population is lower than we would like to see. In some school districts, only about maybe a third or so of this group of people have signed up for the benefit. Fortunately, due to some advocacy, this has been streamlined a bit. Washington State has been approved for a deadline extension. So families now have until September the 11th to apply for this benefit. And DSHS heard some of our concerns about optional questions related to social security numbers and other unnecessary information that they are now removing from their online application portal. We have put together sort of a training resource guide related to Pandemic EBT. It includes a half-an-hour video that explains the benefit, as well as a downloadable PDF that has step-by-step instructions for how to fill out the online form. We encourage you to check out that resource if you work with families with children. And again, the deadline is the 11th of September. Please reach out to us if you're looking for additional assistance or training on this topic. And that information lives on our coalition blog on our website. Another entry you can find there is a free workshop that we hosted a couple weeks back in partnership with HopeLink related to financial empowerment resources. We had a 2-hour workshop that took a deep dive on the Your Money, Your Goals Toolkit, which is a resource put together by the Consumer Financial Protection Bureau, essentially helping homeless service providers communicate financial terms and, empowering people that you work with to make informed financial decisions that are culturally appropriate and in line with their values. We've recorded the 2-hour training and we have links to all of the PDF documents that are referenced in there. We encourage you to watch the video and pause it periodically to then review the toolkit in detail. And again, if you want further training on this or if you have questions about how to best utilize the toolkit, please do reach out to us. And then one last quick announcement is that King County Metro has decided to suspend their fare enforcement through the remainder of September. So service on the bus, streetcar, water taxi, van pool, and via service will be fare free through September. They will make an announcement closer to October as to what they expect for that month. I do want to note that Sound Transit is still collecting fare enforcement on the express bus and Link Light Rail. However, King County Metro is still fare free through the month of September.
Jason, can I just add a quick thing to that? I think we have talked here about the fact that Metro is struggling with how to do the best job of keeping both riders and drivers and other Metro employees as safe as possible. And they have been moving towards implementing, when fare collection resumes, as much as possible, having what they refer to as contactless payment. Now, we've been involved in conversations with Metro because to them, contactless payment ideally involves no paper tickets, no paper transfers, and no cash. And we at the coalition and our partners at Transportation Choices Coalition, One America, Puget Sound Sage, and the Transit Writers Union have been pretty clear that that's not a viable option for people who have very little money and who may rely on bus tickets and transfers and partial or full payment through cash. So that conversation is ongoing. I just want to mention it now because it's going to come back up in September, and I want you to be thinking about it and aware of it as we try to problem solve and hope that what we are able to do is to implement the income-based fare that ties to people's income in a way that increases people's access and doesn't decrease people's ability to use Metro. Thanks.
Thank you, Allison. Now, at this point, we want to transition to reviewing an exciting new resource, courtesy from our partners at the Healthcare for the Homeless Network. It's some updated COVID-19 guidance for service providers. We are lucky enough to be joined on the call today by Michael Young Hall with the Healthcare for the Homeless Network, who has been working on this update of this provider outreach toolkit and has graciously agreed to join us to review some of these tools and highlight how you as an agency can best take advantage of it. Michael, thank you so much for being here this morning.
Thank you very much, Jason. Hope everybody's having a good morning. My colleague Shantae Stubbs may be joining us, but if she is unable to hop on, just want to give her apologies in advance. She just got caught up in a bunch of other meetings, but happy to represent and answer any questions that I can. And then, what's it called? And then if there's any questions I don't have answers to, I can definitely get those from a variety of teams that work in our department. And so as Jason mentioned, we have put together a toolkit. And so I'm going to share my screen so that way everybody can see it. I'm going to preface this with, it says outreach provider toolkit. It does not necessarily have to be used for outreach providers. And as Ms. Allison has stated before, a lot of the information in here could be useful to many other homeless service providers and just service providers in general. And so even if you are not an outreach provider, feel free to use the toolkit to take advantage of the information that's inside of it. And we also always ask for feedback. So if anybody is looking at this, if anybody is using this toolkit or using the items that are in this toolkit with their clients and have any concerns or interests or just things that you think may be better, then definitely let us know. You can send an email to me. My email address is the letter M, Young, Y-O-U-N-G, Hall, H-A-L-L, @kingcounty.gov. And we are always open to making changes and making edits as people bring things up and as we see things that are changing, which, as we all know, during COVID, things change about every 10 seconds. And so, you know, so it's definitely an evolving living document. So the toolkit obviously has a table of contents, and so the kind of beginning of the toolkit, the whole majority of it is around a variety of different graphics that can be handed out to clients. We are also able to print these graphics in color at our office in mass quantities. If you guys would like, say, like 250 of one graphic so you can hand them out to your clients, we can definitely accommodate that. And you can just send those requests to the email address that I gave that I think Jason may have just thrown into the chat box. I haven't seen, but and if you did, thank you, appreciate that. So it starts off with some guidance just around how people can stay safe when they're conducting work in the field. So like I said, it says outreach, but this can apply to any other work that you are doing in the field with your clients. And so it just goes over some of the general kind of basic information that public health has been pushing out a lot. And some of it is tailored. There's information in here around if you are going to be interacting with a client and they don't want to wear a mask, then definitely make sure that as much as possible you maintain that 6-foot distance between you and the client. We've had some providers who have said that when they first go to meet with clients, they will stay 6 feet apart but take their mask off, and then that way the clients can get a good look at their face and just kind of see that it's like a real human, you know, behind it, as people a lot of times just have masks on, and you know, when you have your mask on, you can only see your eyes. It could look a little, you know, whether it's intimidating or just not it's not preferable for building those relationships. So there's a couple of pages of this. There's some more information on field safety, approved PPE is around here at the bottom, and there's some information about that. There's also information about enduring PPE shortages, and there's information on our website, and this is a live link that's in the document that people can click on to go to the website to get information on that. We also have some information for outreach we also have some PPE, excuse me, for outreach providers, and so if you guys are in need of some, feel free to shoot me an email and we can connect on what PPE we have in stock right now and can distribute out in the quantities that we can do. We are also looking to continue to have PPE in stock, especially as we go through the cold and flu season. And there are a lot of unknowns with what happens if somebody were to unfortunately have COVID and have flu at the same time. A lot of the flu symptoms, as many of us know, are going to be the same as the COVID symptoms. And so the uncertainty there is also kind of sparked a lot of interest at public health. And we are trying to make sure that we are going to be in the best shape possible going into this season to be able to support those in the field. So there's information also in here about gloves, about eye protection, about gowns. We do want to preface and say that if your agency has a more stringent PPE guidelines, you should definitely follow those. And so if your agency says that whenever you're doing work in the field that you are going to be, that you need to wear eye protection, even if this says this may not be necessarily recommended at public health, but you definitely should follow your agency's guidelines to be able to stay safe. So there's more information at the bottom about like how to take care of yourself. And then we kind of move into the guidance flyers. So these are the ones that typically all of them are printed front and back. There's a variety of different topics. There's a general health warning for people who are living homeless that just kind of goes over some of the general information about COVID-19 for clients. And we tried to make each of these different colors so then that way it's easy to tell them apart, because kind of the layout is pretty much the same on all of them. So there's information about washing hands, about wearing face coverings, using hand sanitizer if possible. There's information about kind of the more severe symptoms around COVID-19. And then places where people can go seek medical attention if they feel the need to. And then at the bottom here, we just have some information around calling 911, because we definitely don't want people to be, in a sense, shy about calling 911 if they are having any of these symptoms, as these are definitely more severe COVID symptoms, and 911 can definitely respond quicker than, getting them connected to IQ, and may just be better equipped to handle the severity of their symptoms, as well as any other any other disorders that they may be having at the same time. Um, there's information around wearing cloth face coverings and some CDC guidance about how to make one from different materials if people don't have one of their own or haven't been able to get one from those that they are working with. And then just some general information about how to clean the cloth face covering. And so we definitely are suggesting, not mandating, definitely suggesting, if possible, to give people 2 cloth face coverings. So that way, as they are cleaning one of them and it is air drying, they are able to have another one that they are using as well. And we also wanted to make sure that people knew to make sure that their mask completely dried before they put it back on. So then there have been a number of people who have not wanted to go to IQ for a variety of different reasons, but have preferred to self-isolate in their tents or the RV cars, etc. And so for them, we have a number of just kind of tips of like things that they could do to be able to stay safe while they're there. We have heard some comments around sleeping, and we are investigating what's the appropriate course of action, appropriate guidance around sleeping, as don't want necessarily people to have to wear masks while they're sleeping, but do understand that if they're sleeping in areas where there's other people, that could be a possible time to spread COVID as they are breathing in and out, and could be coughing or sneezing or anything like that in their sleep, and it just there's not proper air circulation, and that definitely could just be moving on to others as well. So we are going through and investigating what are going to be the best options for suggestions around sleeping, especially as we're talking about congregate shelters and, as I mentioned earlier, moving into cold and flu season. So then this part, the COVID-19 symptom chart, is the back page to the graphic around staying outside or isolating outside. And so has kind of some symptoms around when you should call 911. And then some more symptoms down here around when it'd be probably more appropriate to call the COVID hotline and see if somebody is welcome to going to the IQ. The isolation and quarantine is what we use for IQ facilities, which we will touch on in just a second. There is this graphic that we 100% stole from Metro, just around getting some more information around how to stay safe when on the bus. I'm sure many, if not most of you guys know that right now for Metro, it is required that people wear some type of mask or face covering when they're on the bus. And I don't know if they have started providing any or not. I know they were experimenting with some ways of having kind of dispensers on the bus that other places have tried out. And so I know that they are working on that, but I don't know if it's actually come to pass just yet. And then the last one is just around staying safe when people are waiting in line, whether it's for food or for shelter, or for a variety of other different things. And then one of the ones that has been most requested is information around our isolation and quarantine. So this is a frequently asked questions. This is just kind of some of the things around how long people will have to stay. Can they bring their pet? People can absolutely bring their pets. If it is a service or emotional support animal, the pet can stay with them. There's no documentation needed. They just need to say that this is an emotional support or a service animal, and the IQ team is totally happy to allow them to have their pet stay. If they, in a sense, do not want to bring their pet, we definitely have trained staff who can care for their pet, and their pet will be returned to them as soon as they leave the INQ site. Their partners are welcome to stay in the same room, but if one of them tests positive for COVID and the other one does not, that may extend their stay by up to 14 days past the 10 days that they would have to stay to make sure that their symptoms are gone and that they are no longer spreading COVID. There's definitely designated smoking areas. They can have visitors, or they cannot have visitors, excuse me. People are welcome to drop things off at the front desk, but they cannot necessarily enter their room or interact with them in that way. A big piece I wanted to mention is IQ can start Suboxone, but they cannot start methadone. That is something that's highly regulated by the DEA, I think it is. And so they can definitely continue to receive their treatment while they are in isolation and quarantine if they already have started methadone, but they cannot start it at the IQ sites. We also just wanted to give some pictures for people at the bottom of just like what it is that they're going to. We have heard some things about people maybe equating IQ to going to jail or going to like a asylum or things like that. And we understand completely why people may think that, just from we are a government entity that are in a sense sending them somewhere. And so definitely understood that, but also wanted people to kind of know like we're not, like they are comfortable rooms, they have different things for people to do to be able to stay engaged and just stay active and different things like that. The staff there is great, and they are engaging and welcoming, and definitely enjoy the service that they are able to provide to the community. Like you see here, there are 2 sites that are operable right now, and based on which kind of like the different things that and supports that people may need will determine which site they go to. I don't necessarily have the details on which site has which supports, but if that's something people are interested in, I can get that from our IQ team. And so the last kind of like 15 to 17 pages are just information on isolation and quarantine. Many of you guys have probably seen this before, and a lot of this stuff is in separate places on our website, but we wanted to combine it all together into one place, into this toolkit. And so feel free to look through it. It's not like super private information. Obviously, this is posted on our website, but it is something that this is more information that's geared towards service providers and just helping them navigate the system rather than, in a sense, necessarily like handing out to clients. And so we definitely suggest using all the graphics and the IQ frequently asked questions, definitely be able to give out to clients. And then this is kind of the section for the service providers. So it just has information on what the routing from the call center to IQ looks like, and the disease investigation. And there's a bunch of other pages that I will not bore you with right now that people are welcome to look through. So I will stop talking and open it up if people have any questions.
Thank you, Michael. Are people able to request printed copies of these color handouts for their program?
Absolutely. If you just shoot me an email that I read out earlier, and I can give out again, and just let me know which handouts you would like and how many copies. You can have them printed in color at our office, and then we can arrange for you guys either to come to our office in downtown, or we can come drop them off at your location, wherever that may be. And so my email is the letter M, Young, Y-O-U-N-G, Hall, H-A-L-L, @kingcounty.gov.
Thank you, Michael. And then we do have one question in the chat. Are you going to offer on-site flu shots?
Ooh, so that I don't know. I don't know that we're going to be doing it here at the Chinook building. Our team, we have many teams who are working on flu right now on what that's going to be looking like. I'm assuming that, as we have done in the past, there would be a number of different flu clinics that would be held at a variety of different shelters and permanent supportive housing sites that are always free for anybody who wants to do it. I believe they will also be giving Hep A vaccines as well. I do not have the details on that, but I can definitely talk to our teams that are working on flu and connect back with that information.
I just want to note that Michael and Shantae and their colleagues at the Healthcare for the Homeless Network are some of the most responsive and accommodating government partners that we have. You know, the Healthcare for the Homeless Network occupies an unusual role in that it is housed within our public health department. Different communities have different ways that they operate their Healthcare for the Homeless networks. And as the pandemic began, we had a lot of conversations about the need for clear, graphic information about COVID-19 and how to keep people healthier and safer. And it really was not until Michael and Shantae and others took that project on that we got any materials that were really designed to be available for people experiencing homelessness, and potentially for people who may have difficulty reading or who may speak languages other than English. And what I so appreciate is that they consider this to be a work in process. So I really encourage people to explore these resources, ask for copies of them, and also, as Michael invited, give some feedback, because they're really interested in making sure that these materials are useful in your respective work environments. And obviously people are different, and you have different communities whom you are working with and serving. I think a lot of the language around this pandemic is really scary. And so things like health warning for people living outside can not necessarily land in the best way. So if you have other suggestions about language or adjustments that would make these materials more useful, this is really your opportunity to be in dialogue with your partners at the Healthcare for the Homeless Network. They are really interested in that level of engagement. And I want to thank them so much for taking the steps that they have taken to make this information available to people who really at this point don't have a lot of the basic facts they need.
We definitely appreciate your thanks and gratitude, and we are definitely here to help and serve. And as Ms. Allison said, like as people are looking through them, working with them, we are definitely willing and looking forward to making changes. And I would just mention there are 2 documents that are in process right now, one around testing and getting tested, and one around kind of taking the isolation and quarantine frequently asked questions and making it into a more graphical form that can be passed out to clients, as well as the more written form that's in the packet right now. We are working on to the testing language. All of our graphics, including the testing and the isolation quarantine ones, were not only just made by government employees sitting behind the desk, but definitely was made in partnership with those experiencing homelessness and with some direct service providers as well. And so the testing and the IQ ones that I just mentioned are having their review and comments by the direct service providers and the individuals experiencing homelessness at this moment. And so we'll be getting information and feedback and be in dialogue with them soon about changes and additional edits that they would like to see and that they believe would be more beneficial into the community.
Great, thank you.
Thank you so much, Michael. Again, we'll be sharing this in the follow-up email, and I really encourage everyone here to check out the Healthcare for the Homeless Network website. They have a wealth of information for people in this work. Michael, thank you so much.
Thank you very much.
Okay, so we are coming to the end of the general public portion of this meeting, but we did want to touch on a couple of quick updates first. We wanted to check back and let you give an update on our Project Cool Back to School program. My colleague Sasha Koberling has been doing truly phenomenal work these last couple of weeks in figuring out how to connect folks with school supplies in a socially distanced way. Sasha, thank you so much for the work you've been doing on that.
Yeah, hi, thank you so much, Jason. My name is Sasha, and I'm the administrative coordinator with the Coalition on Homelessness. Many agencies here are connected to our work with Project Cool and have been in previous years. And you may notice it's a lot different this year. Usually we will have hundreds of volunteers helping us stuff backpacks. We'll have case managers come to our location in Columbia City to pick up their items and also participate in stuffing backpacks. But this year we are excited to still be able to provide school supplies to member organizations and students and families who are currently experiencing homelessness. And so we are able, we've gotten pre-packaged backpacks delivered directly to member organizations to help with that no contact in supplies. Scholastic was generous enough to have donated thousands of books for students who are experiencing homelessness, and myself, Jason, and one of our trusted Project Cool volunteers have been working to get those pre-sorted for case managers, and we're really excited. There are some really interesting, exciting books that they have provided, and we have contacted our Project Cool contacts to be picking those up next week on Monday and Tuesday. And then we also have some donors who helped us secure USB drives for students as well. And we know that with remote learning and still waiting to hear how the entire school year is going to pan out, our support for students is looking a lot different this year, and hopefully we can continue to make Project Cool happen in a way that is helpful for case managers, organizations, and the families that we are serving. Yeah, thank you.
Wonderful. Thank you so much, Sasha. And then Allison, I think you have some real talk that you want to give to our members, if I'm not mistaken.
Okay, well, real talk is my neighbor has rented a pile driver and has started using it outside my window right now. So if there's a lot of background noise, let me know and I will see what I can do. We have had a number of conversations here together about the fact that there is a lot of additional strain, and really, I would say in some cases, secondary and sometimes primary trauma for people who are doing this work. And this was work that was difficult and draining and also powerful before COVID-19. And things have become much more complicated and the stakes are incredibly high and everyone is really feeling the pressure. So we're trying to think as a coalition about how we can support all of you in supporting your own well-being, positive mental health status, resiliency, and that of the people whom you work with and for. One of the things that I think we miss by not being able to be together in a room or bump into each other in a coffee shop or sit next to each other on the bus when we're commuting is the chance to have that real talk conversation about, you know, I was trying to help somebody today and things were so hard and nothing seemed to work. And I just don't think that I'm going to be able to get this person what they need, or we're doing everything we can and we're serving fewer people. And I can't really imagine what we're going to experience when things get worse. If they get worse, which we hope they don't. And so we wanted to really also bring in some of the expertise that lies within our coalition and have a series of what we are calling real talk conversations. Not really a training, but also not yet another meeting, an opportunity for us to get together and, I guess, hang out and talk. We've this idea has been generated through a number of conversations, including with some people, actually Jody Rao from the Healthcare for the Homeless Network and Heather Barr, who's a longtime public health nurse, but also folks who are direct service providers who've said things like, you know, they've asked questions like, what do I say when one of the guests staying with us asks me, how long am I going to have to keep wearing this mask? Or what do I do when I realize that I'm working a 13-hour shift and it is really getting to me? So we're going to experiment. We're going to try this in September. And I think just talk about some of the issues about, okay, everyone knows we need to wear masks. We need to encourage others to wear masks. We need to wear them properly. We need to do all these things. But what do we do when somebody says, I'm not going to wear a mask, you can't make me? Or what do we do when we ourselves feel like, I just can't stand wearing this thing for another 3 hours, I need to take a break? Those are real things, and we're going to have some real talk about them. We invite you to give us your ideas and even to offer sharing up a conversation that you might have had with your coworkers or your guests or residents or clients. The goal is for us to provide some support to one another by getting real about the situation that we're in and continuing to provide quality services and excellent, well-informed advocacy so that we can save lives and get people housed and not burn out. So that's the idea. We'd love to hear if you think that would sound appealing. Oops, hi Shadia. Were you trying to offer something or was that a mistake? Okay, so please feel free to say in the chat if that seems like a good idea to you, if there's something you'd like to do. We're also going to experiment with maybe doing it towards the end of the day. Maybe people can just get a cup of tea or whatever you like to drink and think about what kind of real talk conversation would help support you and the folks you're working with. Thanks.
Thank you, Allison, and be on the lookout for an invite to that meeting soon.
Well, not soon, in September.
In September, yes. All right, so before we transition to our next piece, I want to take 5 minutes here really quickly just to open up the floor for some member updates from the community. And I'd like to start with Karina O'Malley, who attended a virtual ribbon cutting ceremony for a new program on the East Side yesterday.
Thank you, Jason. I'm Karina, and on the East Side, since 2008, really, we have provided emergency services for people experiencing homelessness in a series of faith community basements and different locations. And we were really proud of the fact that we got finally to the point where we had a day center in one place for women and a different one for families and a different one for men. And then an emergency overnight shelter that would move every couple of months from this church basement to that synagogue basement, mats on the floor. And that is literally was our entire infrastructure for serving people with homelessness on the East Side. Yesterday, we did a ribbon cutting for a 24/7 service building that was designed to serve people. The first floor is going to serve 50 people in families, the family definition being any group that has at least one person over 18 and one person under 18. And then the second floor is going to be able to serve 48 women that can stay there full time. And the idea was before COVID that we would also be able to provide drop-in services, day services, anybody in either of those two groups that was in crisis any time of the day or night would have a place to go and hang out and figure out what the next steps are. We've really never had that on the East Side before. I'm super, super excited that it's open. People are moving in this weekend. And our capacity will be a little bit lower because of COVID, but still we'll be serving a lot of people and in a really respectful and life-affirming way. And Bellevue is still working on this for men, but we're gonna get it done. I'll put the link to the ribbon cutting in the chat because it's really a testament to the entire community coming together, every level of government, from neighborhood association to the state of Washington, and nonprofits, businesses, the government folks, the neighborhood. It's just an amazing collaboration. Very exciting.
Thank you so much, Karina. That's wonderful news. Glad to hear it. And then we are also joined this morning by Dui Tran with DESC, who has an update related to their rapid rehousing program that they want to share with us.
Hi, everybody. This is Dewey from DESC. Thanks for giving me some space here to talk a little bit. So our rapid rehousing program at DESC has been restarting enrollment, and usually we get our enrollments from CEA, but I'm sure folks who have had experience with CEA know that it's an imperfect system. Though there has been recently some changes to the CEA, or the Coordinated Entry for All system. So now we're able to get external fills, not through CEA. So I wanted to offer those external fills to all the folks here. If y'all are, know anybody that would benefit from the rapid rehousing program, please reach out to me. I'll give a brief little blurb about the rapid rehousing program. At DESC, it's a time-limited rental assistance program, 3 to 12 months. We'll like help the client move in, pay for move-in costs, pay for each month's rent, and sort of help them get stabilized. But after the 12 months, then they are responsible for paying the entirety of the rent themselves. The units that we move folks into are sort of market rate housing, though we do really try to find, you know, whatever is the cheapest on the spectrum of market rate housing, that not being that cheap in the Seattle area, but we are able to place people in anywhere in King County. So I don't know if anybody has any questions or have any referrals. You can reach out to me at my email at DESC. My email is D as in dog, Tran, T-R-A-N, the number 2 at DESC.org. I can screen any referrals that you want, or if you have any questions about the program, you know, please reach out to me.
Excellent. Thank you so much for sharing that information with us today. All right, so we have come to the end of the general public portion of our general membership meeting. For those of you who work directly with homeless students and their families, please stay on the call so we can facilitate a small group conversation with you. For everyone else, thank you so much for being with us here. We meet here on the 3rd Thursday of every month from 9 to 11. Our next meeting is going to be on Thursday, September the 17th. We'll be dropping a link in the chat as well as including that in the follow-up email, and we sincerely hope to see all of you there. Please send myself or Sasha an email if you have any follow-up questions from today's meeting that you would like further clarity on.
And I will just say, you might have noticed that there isn't a live music portion of the agenda today, but we're going to be working to bring that back for our September general membership meeting, since we've gotten lots of positive feedback from people about using the last 10 or 15 minutes of our meeting to share some music or poetry. And if you know a musician or a spoken word artist who you think might be interested in joining us, you're most welcome to send their contact information our way. I just saw someone, Janelle asked, is the meeting over? The point that Jason just made, Janelle, is that we are using the last 30 minutes of this meeting to gather information from people who work directly with school-age kids experiencing homelessness and their family members to help inform an information session that we're hosting every year for over a dozen years. The coalition has hosted a Helping Homeless Students McKinney-Vento 101 workshop as part of our back to school education and advocacy work. And this year, obviously, things are dramatically different. And we are seeking information from you, our members, to help guide the content for a workshop or information session that we're going to be hosting on Thursday, September 3rd. So the last 30 minutes is small group conversation, and you're welcome to stay, and we're grateful for your input if that's part of the body of work that you do. Thank you.
Thank you, Allison. So what we're about to do is divide you up into breakout rooms of 4 to 5 individuals. We're hoping that this will give you the space to have an open conversation amongst yourselves about what supports are needed. We've created an online form for you all to collectively take your notes on, which will be dropped in the chat box that you'll see when we get into the breakout room. You'll see that there are 5 prompt questions that we encourage you to go through. We want you to take about 20 minutes or so to review those questions, share information with each other, and then we'll do a brief share back once this whole process is over, just to share some highlights of what we discussed. Again, we are doing this to inform the content of our upcoming Helping Homeless Students McKinney Vento 101 workshop, as Allison mentioned, so that we can understand what people's needs are during this very unusual back to school time. And I think that's going to take us to the next session here. Sasha, is everything prepared to be able to set that up?
Maybe while Sasha's unmuting, I'll just say, let's just pause for a minute while we have folks together. It's a smallish group of 14 people. So we might just try splitting into groups of 3 or 4 rather than 4 or 5. And before we break into those small groups, does anybody have any questions or things they want to say while we're together? Okay, let's just see. Sorry, I might have missed this, Jason, but we recognize that not everybody is able to use a Google document while you're on a call. So if there's anybody for whom that's an issue, we just want to try to capture the thoughts. So you are welcome to send us comments in an email if you're not able to use the Google document. But our idea is that essentially, just as you would designate a note taker if we were in person and have somebody write, maybe if there's one person in the group who can fill in the Google form, that will help capture the group's conversation. And I think the only thing I want to say is, especially with smaller groups, we may find that honestly 10 to 15 minutes is plenty. So I want to invite people to come back to the group, and Sasha, maybe you can explain how to do that, and I'll respond to Shadia in the chat.
Yeah, so I'm about to start the breakout rooms for everyone. What I'll be doing is I'll share the Google document in the rooms as well, and then when we're about 5 minutes out from closing or 3 minutes out from closing, I'll also broadcast a message that we'll be ending the rooms, and then we'll bring everyone back into this main room for any closing remarks and sharing. So I am going to break these rooms out. 1 second. All right.
Hi, Amanda and Ashish.
Hi there.
Hello, how are you?
I'm doing great. I'm doing great. I'm sorry. I had a few technical difficulties the past 5-10 minutes.
Oh, well, we're happy that you're able to participate in this part of it. Maybe we can just do some introductions, because I don't think I have met you or Amanda. And
Cool.
Sasha and I are here from the coalition, and we'll introduce ourselves.
Awesome.
Yeah. Do you want to start us off, Ashish?
Yes, let's do it. So my name is Ashish Pamula. I'm with Samaritan. I actually just joined Samaritan probably a few weeks ago now. So I'm very green to this meeting. This is my first meeting, and it's been pretty great to just take in all of the information. Thank you for all of the resources and everything that you've provided so far. But yeah, I'm really happy to be here. So thank you again.
Do you work directly with school-age kids experiencing homelessness and their families?
No, so I work with Samaritan, which is an organization in Seattle that partners with other or organizations that work with the homeless in Seattle, particularly.
Okay. So I'm just going to say this conversation is specifically for service providers who are working with school-age kids and their families.
Got it. Okay, so pretty much I'm here to listen.
Yeah, well, I honestly, I don't know, and you're welcome to listen, but this is really about helping to inform the workshop that we're developing. So
sure, okay.
Yeah, okay, great. And I see Amanda Eason. Do you want to introduce yourself?
Yeah, hi, I'm Amanda. I'm with the Low Income Housing Institute. I also just started on Monday, so completely, and yeah, I'm like just getting my bearings, trying to learn as much as I can. And I'll be working with the Tiny House Village program. Yeah, so thank you for having me.
Great, thank you so much. Are there school-age kids with families in some of the tiny house villages where you're connected?
Yeah, I don't know. I just really don't know that much about it, but I do know like we serve children.
Yeah, thank you. Great. And Tina Berkeley, a familiar name. Let's see, Tina, you might be muted. We're not hearing you. Uh-oh. And Sasha, I can see that you're talking, but I can't hear you either. So, Tina, are you able to use the chat box? Interesting. This has not happened before, but I will have to do some problem solving. Okay, so the questions that we had, it may actually be a little bit challenging for this group, just given the nature of your, you know, being very new to your position, Amanda, and the fact that we can't currently hear Tina. Tina, I'm wondering, let's see. All right, Sasha might be trying to do a little bit of problem solving here. So Amanda, do you, what we're really trying to understand is what are the main concerns that you as staff have, so you may need to take these questions back to your colleagues potentially, but also what are the issues that parents are grappling with and students as well as they look ahead to what is going to clearly be a very unusual school year. So maybe one of the things we can just start with is there anybody on staff at Lehigh who is the lead person for working with kids who are enrolled in school? Do you have anybody agency-wide who's got that responsibility?
Yeah, I'm not sure the answer to that question. I'm not sure. I know that like each village might prioritize like welcoming families into the village differently. And then the case managers in each village would have like ideally more expertise like working with kids depending on like the nature of that village. I'm not sure about like agency wide what that looks like, but I'll definitely need to consider. Yeah. So
one of the things that we like to do every year is this back to school helping homeless students workshop. And typically what we do is we talk about the federal McKinney-Vento 101 law that actually protects and lays out homeless students' educational rights under the federal act. But as with many things, that is really, although it is still the law, it is really, really constrained, I guess, by COVID-19. So we're going to be hosting this info session on Thursday, September 3rd, and we're going to have people from Building Changes, and I hope from Team Child, to both talk about what the protections are for homeless students, but also do some problem solving. I expect that one of the biggest issues that people are going to be grappling with is technology, because this is virtual. And Tina, if you're able to type, maybe we'll just include you in the conversation as you put things in the chat box, because Sasha and I can both look at those and talk with Amanda at the same time. But so I think maybe let's just start with what the technology connectivity is, as far as you know, Amanda. Oops, and you're muted. There we go. You could just keep yourself off mute. We're such a tiny group. I think I wouldn't worry about muting yourself, but thank you.
Yeah, I think I just have a hard time like definitively answering that question. I don't want to like say something that's not true, just because I'm still in the learning phase.
Yeah.
But I do think that is like a widespread issue, is the lack of technology or even like phone access that people have. Yeah.
So I know it will be different at each of the different sites because they're physically so different. And as I understand it, there are actually only a few sites where there are school-age kids, but then there are other Lehigh programs where there are lots of kids. So I'm wondering a couple of things that maybe you could try to investigate. One is for the tiny house villages where there are school-age kids or other people who need internet connectivity, what is the connectivity? And then there's the question of what devices do people have access to? One thing that I might encourage is exploring whether some of the Lehigh properties that are physical buildings, like transitional or permanent housing, could potentially provide workspace for students who are living in a tiny house village. That's sort of like in the problem solving mode of, you know, the buildings probably have much better connectivity, power outlets, and all of those sorts of things, as well as just physically being able to offer a table and a chair for kids to sit at. So that might be an opportunity to explore how you can support kids. I think what we're going to do, and Tina I see is having technical difficulties as well, and I know that in her work she does work with families with kids who are school age. Sasha, I think what we'll need to do is we will need to do this as a Survey Monkey and send it out, and then Amanda and Tina can share it with their colleagues. Yeah, because I really, really, really appreciate this opportunity to talk with you, but I also get it that there's very little that you can say right now. But we're really glad that you came to the meeting.
I do have a question.
Please.
Is there like any sort of statewide or like Seattle policy with the public schools to provide technology to students who don't otherwise have it, like during the pandemic?
Well, that's a great question. So this is part of why we have this info session coming up. Each school district has some different responses. The Seattle Public Schools, I believe, have committed in theory to getting devices to each child, and it's a little bit different depending on what age or grade a child is in. However, our experience so far is that that has not been fully realized, not even in this, you know, not to date. So I think for you to start by doing an assessment, first of all, what's the connectivity that you can offer, but then second of all, like what are the devices? And maybe this is an opportunity if there's a computer room at a Lehigh building that's been shut down because of COVID-19, what might it look like to designate that as a student learning center, you know, and to have basically good physical distancing, you know, mask wearing and some adult supervision, but to offer that potentially for kids who wouldn't otherwise be able to get online. You know, among the things that I have to think about is even if kids have a device and even if there is connectivity and Wi-Fi, I don't know to what extent the tiny house villages are set up for people to be charging their devices or to have multiple people on the Wi-Fi at the same time. And the other thing is, you know, if kids are in a small tiny house with their other family members, it's still not exactly the best learning environment, especially if there's more than one kid trying to take different classes at the same time. So I suspect that as service providers, those are the kinds of issues that you'll want to be trying to suss out, while we also work, quite honestly, with not only the school districts and the state office of the superintendent of public instruction, but also with lawyers to make sure that kids get the resources they need.
Awesome, thank you.
Yeah, and I think for kids who have individualized education plans, so they have special educational needs, there's going to be even more advocacy really needed to support those kids and their families getting what they need. You know, not everything has to be online. If the schools had a good way of getting hard copy materials to kids, that could also work or supplement. But again, that might involve you as staff figuring out, because you might have kids who are at 4 different schools in 3 different districts. And then, you know, how are you going to help make sure that they get the materials in time? You know, I think these are the kinds of issues I would anticipate you and your colleagues are going to need to work together to figure out. I see we've been joined by another person, Jay Pershing. Hi. Are you able to unmute yourself, Jay? Interesting. We've never had this level of difficulty before, so I am interested to see.
The breakout rooms we're still trying to play around with too. So
okay.
We'll do some troubleshooting with that.
Yeah. All right. Thank you, Sasha.
Yeah, of course.
Interesting. Okay. Any other question that you might have, Amanda or Ashish or Tina, since we're probably going to wrap up this small breakout room?
Yeah.
I've got no other questions, but I just wanted to reiterate again, thank you again for all of the information today, all the resources. They've been extremely helpful, and this talking space is extremely great for me to be a part of. So thank you again.
Great. Thank you very much. We're glad you could join us.
Yeah, I definitely want to second that. I wish I could be more helpful and have more information to contribute, but still just in the learning phase.
That's totally fine. We understand that, and we're glad you're here too. It's a good sign to us when somebody who's just been hired shows up at a coalition meeting. So you can get it on your calendars, you can sign up for email, and Jason will send a follow-up email to you guys with additional links.
Awesome.
Okay.
Thank you.
Sasha, I'm going to actually jump off so that I can make a quick phone call.
Everyone.
Oh,
okay.
Tell me what, yeah.
Oh, no, that's great.
Want to give us instruction? Okay. All right. Oh, everyone's coming back together. Look at that. Woo!
Everyone's coming back in. And we'll do a quick share back, and hopefully that worked fairly smoothly. So.
All right. Well, thank you everyone for bearing with this this new format that we're experimenting with. We'd like to take just a quick moment before we end the meeting to touch on a couple of highlights from what was discussed in the group. And let's see here. I think from the group that I was in, I think either Laura or Carlos, would you be willing to share just a couple reflections on what we discussed?
Yeah, so we talked a little bit about some of the things that worked, or some of the changes that our organization faced when we had to work remotely. One of the things that I had mentioned was that since our organization really focused on in-person meetings and physical documents that we would fill out with the clients as they came in, we found ourselves having to create online cloud spaces, online editable documents to make sure that families could apply for our emergency rent programs. We also talked about how and Laura, if you want to jump in, definitely feel free. We also had some general points about what the needs of families and children might look like given the beginning of the school year. We talked about how some families might be faced with difficult decisions of access to daycare, especially if they're essential workers. We talked about how students might need more access to mental health resources, given that they are working more from the homes instead of the usual school routine, and especially for those students who are graduating in the 2020 class. So those are the general topics that we discussed.
And just to touch up a little bit on that, hello everyone, my name is Laura. I work with Carlos at Bellevue Live Spring. I'm also one of the Human Service Administrators. And a big part of our population that we serve are non-English speakers. So that is a big part of what we are trying to bridge. We're trying to bridge that gap between families who are unable to communicate effectively with faculty and staff and their districts. And then also trying to help bridge the gap for families who are not able to, why can't I think of the words right now? I'm sorry. They're not able to access internet, or they may or may not know how to navigate through the applications and programs that are going to be given to them by the district for remote learning. So those are the areas that we would really like to dive into with them, and hopefully be that bridge if and when we can, and then more so for emergency rent and first month's rent assistance for families that are finding themselves still waiting for unemployment, still waiting for DSHS assistance, still waiting for TANF, or just are unable to work right now because they're having to make those difficult decisions, like Carlos said, about whether or not they're going to return back to work. And if they do, who can watch their children? And then if they don't, how are they going to be able to provide food and shelter?
Those are all great points to touch on. Thank you so much, Laura and Carlos. I really appreciate the robust conversation that we had there. Let's see here. What about breakout room number, I'll skip to 4. I'm seeing some interesting notes there. Does anyone from group 4 want to share some highlights?
So Terry was talking about, she doesn't provide sheltering services, but she's talking about trying to hook people up with childcare services. And, my questions were just like, if you've got a 6-year-old, childcare is going to look a lot different now. And our childcare services equipped to, run basically a one-room schoolhouse for people in different districts, and having to jump on different Zoom calls with different teachers and all of that kind of stuff. And I don't know, it just seems really complicated. And then just sort of basic logistic stuff, like where do you print if you're, a 7-year-old and you're trying to fill out a worksheet? If the only Wi-Fi hotspot is your parent's phone and they're trying to work, and even just physical spaces for a kid in a shelter or in a car or in a tent to sit and be at school. I know the new shelter that we just built, they hadn't imagined when we first designed it that each bedroom would also have to be a schoolroom, right? But they're adjusting and they're putting in a little desk, and, you know, hopefully not all 6 people have to be on camera at the same time in their school, and, you know, giving a presentation where they have no privacy or, you know, place to be in a schoolroom.
Yeah, yeah. Great, thank you. That's really fantastic feedback. One question
Could I share one thing, Jason?
Yes.
Just as an outreach thing regarding this, is that we are talking to families experiencing homelessness and other families around how the childcare system is adapting and how the state subsidy is handling things and how to get funding if childcare is something that they're actually going to need in order to have some, you know, school and childcare in place while they work out of wherever, you know, if they're working in the community and they can't be with their children during the day. So people can call us at Child Care Resources, and we'll problem solve together. We'd love to learn more about the obstacles that the shelter providers are hearing from families.
Terry, Terry, that's great. And actually it occurs to me that it would be really good if we could get you or one of your coworkers to share some of that information on September 3rd, because the next opportunity wouldn't be until well after the school year has already gotten underway. And I think I had to step away for a minute, but I caught the tail end of what Karina was saying and what you just said. And absolutely, this came up just in our little chat with Amanda, who's brand new in her job at Lehigh, but is working with people in the tiny house villages. And I had the same exact image of, you know, what if you have 2 or 3 kids in different classes, all in the same one room, all trying to be on the internet? And, you know, clearly childcare has a role to play in this. So do you think you might be willing or able to, actually the person whom you would be collaborating with is Kayla Blau.
Sure.
Because she's helping to organize this session on September 3rd. So I'll send an email to connect you with Kayla. I mean, I know you can reach her. Thank you.
I just wanted to add to that point. So I am a mother of 3, and actually all three of my children this year will be in school. They will be 3rd, 2nd, and kindergarten. And when shelter in place happened, my 2 at the time, their teachers did a really great job. And I don't know if this is going to be for every district and how they're going to work it, but the faculty did a very good job of being cognizant of siblings who attend the same school. And it seems like they got together and figured out and maybe told each other, this is when we're going to be having team class meetings. These are the times and days we're going to be having individual meetings or like reading sessions, like pod groups via Teams, because that's what they use. So I don't know if that's something that, you know, people would like to push, you know, for the greater population, but it worked out really well, because although my 2 kids were in the same room at times, they never had a class meeting at the same time. There was always at least a 30-minute to an hour break between. And it was really interesting because I was very scared about that. I mean, I'm scared for it again for this new school year, because there's going to be 3 of them now. One of them is going to be a kindergartner. And if that's something that sounds workable for families, that's something that I feel could be pushed out to the districts and to the faculty especially, because there really does have to be that understanding. And, you know, my husband and I, we both work from home, obviously, as do most of us here. And we heavily rely on the teachers. And I know it's a big ask of them, but they also seem very willing to hear from parents what it is their needs are and how they can make it better for you at home. I remember emailing some of my children's teachers and telling them, You know, it's not that I don't want to complete these assignments. It's not that I don't want to be able to sit down next to my child and do this with them. It's I can't from 8 to 5. And that's just the reality of it now. And they're very understanding about it. And, you know, there are some who will say, and it might be like a mandate through the district, but some who will say, you know what, if you can't print it out, that's okay. Write it on a piece of paper, write your answers on a piece of paper, you know, maybe take a picture of it and then send it to me later. So there's all these ideas that they try to come up with to help families who are all at home. And I'm more than happy to, you know, give those ideas to anyone because, well, they're not really my ideas. They came from my kids' teachers, but I'm more than happy to share that if there are families out there who would benefit from things like that.
Absolutely, Laura. I think those are all excellent suggestions, which, you know, may or may not work well when you're in a situation like a shelter where there are multiple families who may have kids in multiple different districts. But I think that spirit of problem solving and keeping the lines of communication open is great. I've heard very mixed things from people I know who have kids. So if you're able to put, you know, in the spirit of here's what worked for my family into that Google document, that would be a really wonderful addition to the suggestions that we're trying to gather.
Sure, I'd be more than happy to.
Thank you.
Thank you.
Okay, I see that we're really at the end of our time, but thank you all very much for participating in this little experiment and helping to gather information. I want to reiterate that Caleb Lau, who's helping to put the content together, is herself experienced working in a shelter for families with school-age kids, also has experience working for the Seattle Public Schools, and also just got a position with the Highline Public Schools. So she's a wealth of information herself. And I think this is going to be a very different kind of session. I really am thinking of it more as an information session and conversation than the kind of typical workshop that we've hosted in years past. We will have people from Building Changes presenting information about the McKinney-Vento Homeless Assistance Act and homeless students' rights under that act. And we're working to get people from Team Child there, as well as Sharon Navas, who's the executive director of the Equity in Education Coalition, to talk a little bit about systemic racism and the ways in which that plays out in the educational system and the ways in which the COVID-19 pandemic has exacerbated those inequities. So I think it will be a really important gathering, but it will be more conversational perhaps than didactic. And that's really just, I think, appropriate to where we are. In our small group, we definitely had people who are interested but don't have a lot of background because they're new in their positions, or they don't work directly with families with school-age kids. So I've asked Sasha and Jason to turn this set of questions into a quick Survey Monkey, and we are going to send it out and we invite you to share it with your coworkers. So that we can get more input that can be used by the presenters who are putting this session together.
Thank you very much, Allison. I had a quick question. Will there be any additional information sharing or kind of brainstorming sessions, kind of like what just happened in the past 15-20 minutes prior to the workshop, or is there any way to be more involved as well?
Well, we have not scheduled them, but if you're thinking that you have more information you'd like to contribute, or there are families you work with who might like to contribute, do you think that the Survey Monkey, well, let me just ask, we haven't planned it, in part because we've got so little time between now and then, but please tell me what would be useful to you. What are your thoughts?
Sure. So I guess, I think just having access to the list of the most pressing problems facing students. And I think that, the survey will probably do a really good job at capturing that, especially if we can get enough people with school-age children to fill it out. But also, I think I was thinking more along the lines of community engagement of the greater community, because you have a lot of people who are currently working in specific positions, working with families with school-age children that are working on these, but you also have a lot of just people from the community at large that would love to help and that have ideas on how to do that in their capacity as teachers and or as parents, and so I think, or even as fellow students. So I think that basically that's really why. And I know, for example, a lot of people in my neighborhood, in my community, who would love to help. They just want to know how they're capable of doing that. So for example, so Janelle, I think, had to get off the call, but I was in breakout session with her. One of the many things that we talked about was, the fact that there aren't enough laptops or tablets that have, for the ability of students to engage in the virtual learning. And we talked about different solutions, but also different challenges to those. And then the second thing that came up was the problem with the postal service and delays in, the materials reaching the students. And so that's why, I was just interested in talking more about things like that, including, out of the box ideas. Like, for example, if there are members of the community that would be willing to take on this task of doing like a contactless pickup and drop off if they happen to live in that neighborhood, or, how there are certain companies, like whether it's Uber or otherwise, that has started branches like Uber Eats. It could be like a philanthropic initiative that we can pitch it to them and say, would you be able to do like Uber education, I don't know, Uber something related to dropping off, learning materials, so that, kind of seeing how we can, rather than try to fix the postal service, which, is its own thing that needs, merits attention, but what can we do in the meantime to get to our goal? So that's basically, all I'm saying is I know a lot of people who have a lot of ideas and the will to contribute, but they just want to know how they're able to do that.
Yeah, thank you. So I love the way in which you're thinking. But what I will say is we want to be very clear that we are not able to solve all of those problems as the Coalition on Homelessness. I think that some of what you're describing could actually be energy that is very well directed at schools and service providers that are in your neighborhood. This is where geographic closeness can really be helpful. Because we are a coalition made up of service providers and advocates, we're really focusing this conversation and our work session on what is the context for people who provide shelter, transitional housing, childcare support, direct services for families experiencing homelessness. I totally take your point. There are many, many parents and others in the community who want to help their fellow family members, peers, the other kids in their schools. But that's really beyond the scope of what we're trying to do this session about. However, my hope is that the schools and agencies like where Laura works, Bellevue LifeSpring, or where some of our other members work, would welcome, the offer to help do pick up, drop off. There's so much need and so much coordination. We're not trying to step into all those other spaces. We're trying to make sure that there are several thousand kids who are in shelter or transitional housing or without any shelter at all. And that the first thing we do is we find out what happened in the spring so that we can use that to inform what's going to happen going into this fall, which is really just around the corner. But
absolutely. Well, I just wanted to say, I didn't mean that I was trying to go outside the scope. What I meant is there are people who are not experiencing homelessness who want to contribute to helping people who are, including families that are experiencing homelessness. And some of the issues do overlap and some of them don't. But I think that you know, if even people who have, you know, shelter and are not vulnerable in that respect have been facing difficulties, I can only imagine how much more difficult it is, especially, you know, if somebody who has a full-time job and is working from home and is having difficulty educating their children. What happens when you are needing a job or multiple jobs, and you also have children and you don't have your own home, or your own shelter? So absolutely, what I meant is I wanted to contribute to that particular issue, but I know other members of the community who are not experiencing homelessness or who are not involved in such organizations, but that also want to help specifically for, you know.
Yes, and I think that that is probably helpful energy best directed at your local school, because that's more likely to be a place that can, you know, put that energy to good use. I'm so sorry, but we are almost 15 minutes past our end time. I have to go. We are so glad. I recognize you. I think you came to our advocacy workshop, if I'm not mistaken, in Bellevue. And so I recognize you and your warmth, and I thank you so much for joining us. And I really think reaching out to your school to say, I want to help and give me an assignment is probably the first step that I would suggest.
I'm already engaged in that. I was just wondering if there's anything you guys can
we will keep it in mind, and you're welcome to join the September 3rd session, and bring your you know, be a source of information sharing. Yeah.
And thank you very much for allowing me to join and to learn about all the
initiatives. Thank you so much for staying engaged. Okay, I'm gonna go. Thanks, you guys. Bye, Terry. Good to see you.